and welcome back to another edition of The End Game, Insiders on Your Side, a podcast that was developed for senior lab executives by senior lab executives. My name is Melissa Butterworth, and I am your proud host of The End Game. Today, I am so excited because we have a very special guest, and we are going to be talking about all things lab stewardship and what tremendous impact it can have for your organization. Now, without further ado, I cannot wait to introduce to you who I consider to be a close friend as well as a colleague and somebody that I have amazing admiration for. Today, we've got Dr. Heather Signorelli joining us. Good afternoon, Heather. How are you?
Hi, thanks so much for having me on. I'm excited to chat with you today and get to spend more time with you. You're one of my favorite folks and mentors, and just excited to be here.
Oh, thank you, Heather. Thank you so much. Before we jump into talking about lab stewardship, I always like to talk about a fun fact about our guests. And I've just recently learned that, Heather, you've actually got 4 dogs. I mean, that blows my mind. I thought I was crazy having 6 cats. So you have 4 dogs?
4 dogs, and I would say it's probably two too many, but we didn't have the third child, so we just kept going with the dogs, 2 bigs and 2 littles. And they're amazing. It's absolute chaos, but it's fun.
No, I love that. I love it. So my question to you, I know you've recently moved from Colorado to close to kind of Hilton. Is it the Hilton Head, South
Yeah.
Carolina area? And did you have to transport like all the dogs? Did they fly down with you or did they ride in the car?
Oh my gosh, if I could sit and talk, we could probably talk half an hour about just that in and of itself. The short story is 2 went with my husband and 2 were driven across. So all 4 drove across. We considered all kinds of different transportation modes to get them here, but they all made it, everybody in one piece. My husband was a little fried when he got here, but all safe and sound 3 days later.
Well, I'm so glad to have you closer. I mean, at least you're much closer to Florida. So I'm so glad to have you closer. And thank you again for joining us today. As I mentioned to our guest earlier, we're going to be talking about all things lab stewardship. And I know that this has been a significant part of your career, and it's been a significant part of what you've done for probably one of the largest health systems in the country. Take us back to the beginning. Like, what inspired you to create a lab stewardship program to begin with?
Yeah. So for the audience, I'm a pathologist by background, and really had some amazing mentors, really that started in residency. And I really wanted to do the lab management side of healthcare, of lab medicine. And what we're seeing across the healthcare, field is that lots of stuff gets added to the test menu, right? Drugs get added, tests get added, but nothing was being taken away. And we knew that tests were outdated. We knew that there were better ways to treat patients. We knew that there was healthcare waste. And so when this whole value proposition came with regards to healthcare reimbursement, we knew that there was a better way we could help streamline what tests were right for the right patient at the right time. And then that was really what we focused on, really even as a consultant in the lab world as a resident and into fellowship. And we just saw that there was such an opportunity to help healthcare systems, to help laboratories really focus on, again, right test, right time, right patient.
Yeah, no, that's amazing. I appreciate you. I appreciate you sharing that. I'm curious. I'm sure that there were a lot of challenges along the way. What did you all do to kind of overcome some of those challenges? And maybe you can share some of that with us.
Oh boy, change is never easy, right? So, and I think when you've got to balance evidence-based recommendations as well as change management and how people feel, and making sure that you're not bringing in change making folks feel like they're losing autonomy. And that is such a hard thing to strike a balance with. For us, when we first started laboratory stewardship, I was actually in private practice, working and helping support laboratories, really kind of in that consultant medical director role. And the biggest challenge we had was really physician buy-in. And so, much like other large organizations had done, this was really about let's build the kingdom that then can help us move the changes across the healthcare system, right? It's not me, Heather, bringing these in. It's here's the recommendations, here's the physician groups that are going to help us build the buy-in, help us phrase this the way that we want, and then help implement this in the best way possible. Because it's building that buy-in that I think is the hardest piece. And oftentimes, that physician to physician conversation is really helpful, but also building a group of individuals who can say, yes, this is outdated. Yes, this doesn't need to be tested, or, hey, we should limit this test in these scenarios, and being able to bring that to a larger medical staff with a group of subspecialists behind it is really what made this successful. And we were able to do this with many different types of tests, whether it was cardiology or infectious disease, really many different areas where we've been able to impact over the last 10 years.
Yeah, no, that's fantastic. I'm sure being a pathologist, I'm sure that the physicians on the other side would probably be more receptive. I would imagine that, right? I mean, plus you're so great with people. I mean, and you have a great way of communicating with people. So I'm sure you are the perfect person to do that.
When I was a resident, I'll tell you this funny story. I was actually applying for residency as a pathology, in the pathology programs. And I was told from a residency program director that I talked too much to be a pathologist. So, I do think that this area of medicine and being able to impact and be able to speak in front of others and work with others to make big changes was something that I was truly meant to do. It's something I really enjoy. I will have to say I've had some amazing mentors and individuals behind me, some great, physicians that, even both you and I know, who've been able to help spearhead this. I do think it takes a village. One single physician needs the support of other subspecialists, that needs administrative support, and so forth. And so that has really been what has allowed this to be successful across a large number of hospitals.
Yeah, no, absolutely. We all need that cheerleader and that person internally, right? That's willing
Yep.
to go to the helm. Well, I know that evidence-based guidelines were really a core. I think they were really a core part of what you put together there and what your team put together there. Now, how did you go about curating these guidelines, and what role did the various clinical committees play with this?
So there's easy ones. There's choosing wisely, right? There's the easy guidelines that are out there that everybody can agree to, that they're the no-brainers, right? And these are, we called those like our top 20 outdated tests. And these are the things that really should not have a ton of heat behind them. They should be the easy things to get through. And so those were like our foundation. That was our foundational model, right? We built these subspecialty physician groups, our clinical committees, as you called them. And then we used those easy wins to kind of get the wheels moving, right? Get the process going of how do we present evidence-based guidelines to a larger group of medical staff? How do we get an impact change from a ITG or LIS perspective? And so that was the easy things. And then came the more challenging things that, kind of have a little bit more gray areas where, you do have to kind of put some guardrails around, but maybe not completely take the test away. And so, I would say for those of you who are listening and trying to figure out, gosh, is this right for my organization, or how do I do this? I would say the best thing and the best advice I have is start with your easy wins, build your process, and then get to the harder things over time. And you're going to be more successful that way.
Yeah, no, that's great advice. Heather, I really think you need to write a book on this, not to give you another project. The reality of it is there's nothing out there. There's no like playbook, right? And so I'm just
Yep.
amazed. I think you kind of like, in my own mind, I didn't really know of a program that existed like this, especially on such a large scale. And so you pretty much wrote the playbook, or you could publish another whole book about this, and it would be such a help for health systems. I mean, I know it encompassed genetics, it encompassed microbiology, it encompassed oncology. And so I know the program really touched on a wide range of testing areas. How did you ensure the consistency and best practices across all of the specialties?
Oh, that's hard. And I would say, if I were to grade myself, I wouldn't get an A+ in that area. It's hard because for us, we've got hospitals across a large geographic, we're across the entire United States. And so, you have to balance the ability for local medical staff to weigh in and make changes to a degree, right? So a group of hospitals in one area of the country who treat maybe a different level of patient acuity than another location may have different needs and desires. And so that has been something that has evolved over time, is really realizing that, patient populations are different. And obviously there's the easy wins, right? The clear cut guidelines saying this test shouldn't be used. Those are easy. Again, those gray zone tests where, we are talking about oncology patients, we are talking about genetics, that's where things get really dicey. And you have to really have that input of that local medical staff to understand what's going on, and then have an ability for that autonomy in a medical staff, group, to be able to say, well, I really need this, and this is why, and these are the circumstances, and this is the change of care. And I think that that's what folks need to really focus on, is asking the question, okay, here's the test, here's the result. How am I going to change management? How is this going to impact the long-term morbidity or mortality for a patient? And then that be the core focus with regards to how you manage a test. And then the rest will develop. And again, I think being perfect is never going to happen. I think it's striking a balance between allowing physicians to do what they are meant to do, but then also guiding that with evidence-based guidelines that are out there.
Yeah, no, that's a great point. I know that you had the support, Heather, of, really a multidisciplinary team of, of subspecialty physicians. What was their contribution, and how important was their involvement in lab stewardship in this program that you put together?
Oh, critical. You have to have, I'm a pathologist. I'm not a cardiologist, not an infectious disease physician. And while I can distill, lots of information regarding evidence-based guidelines, I don't see those patients, and I don't pretend to see those patients. So really going to those groups of individuals and saying, hey, here's the guidelines that are out there. How do we make this into a recommendation regarding how we utilize a test? And so it was that group of individuals at a large national scale that then allowed us to say, okay, these are the things we're going to go after. This is how we're going to do it. Here's where we're going to give some wiggle room, right? Where we're going to say that a group of hospitals can individualize this to some degree. And that's really how we were able to balance, again, that perfect, here's the black and white answer versus, we all know that patients require different things and patient populations are different. So it's not easy, but it can be done. And I'll get to that book here this year then.
Oh my gosh, I would love to see that, because I not only myself, but I can see just, hundreds and thousands of executives in the hospital space and lab leaders really, looking at this and being able to take it and do something that could really help their system. So I really applaud you, for those healthcare leaders that are out there, executives that are out there that are looking to implement a lab stewardship program. What sort of advice would you give them, and what would the steps be that you would recommend to ensure a smooth rollout?
So I think first things is really having a strong physician leader. I do think that that's very important. I think building a structure around how you get buy-in and how you roll something out is really important. You need both of those things. And then it comes down to finding the opportunities, right? So obviously, if you've got a physician leader, if you've got, a multidisciplinary team of physicians who can help get the buy-in, now we need to figure out, where are we going to start? And that's really where choosing wisely is a good place to start. Those are your easy wins. That gets the motions, or what am I trying to say? You can
The wheels rolling. Yeah.
Thank you. And I think then it's about working with your ITG, your LAS partners, to really understand, okay, where do we see test utilization? What are the volumes? Do we see patterns within that? And then this evolves into much more than stewardship, right? This evolves into operational standardizations and contracts and vendors. I mean, there's the snowball of what happens when you really solidify a really good stewardship process allows you to operationally be able to impact so many different areas. And you start to then it's like peeling down the onion, or, then you start finding revenue opportunities and ways that you can help manage people differently. So, I would say, first things first, get your committee, get a good, strong physician leader, start getting the data around the targets you want to pick. and don't pick all at once, right? Start with a handful, see how it goes, and build from there.
Yeah, no, that's a great way to summarize it. I'm curious from your perspective and looking back now that you've implemented this, and when you look back, how has this program with the lab stewardship that you put together, how has it actually affected clinical testing within the healthcare system?
I think it's allowed folks to realize that there are outdated tests. There are tests that we shouldn't be using anymore. So we can focus on the results of the tests that matter. I also think it's just making us start to think, what is going to be the result of doing this test? How am I going to change management? What is going to be that change in clinical care? Because then when you start asking yourself, well, I'm not going to change management, why do I need to order the test? And I think that that's the place we need to get to in medicine, is really understanding, why am I doing this and what am I going to do with this information? And if you don't have a clear thing that you're going to do with the information, you've got to question why you're doing it in the first place. Healthcare resources are only so much. And I think it's really important for physicians to be part of that solution. And I know, the healthcare and where we are in healthcare is a much more complex issue, and lots of stuff we could sit and talk and help and fix. But this is, one small piece that I felt was impactful for the healthcare in general.
Yeah, no, that's a great point. I'm curious, what sort of metrics or outcomes have you seen as a result of the program? Can you share a few examples just from a high level perspective?
Yeah, I mean, we've definitely seen savings, of course. I mean, definitely some really good savings for the healthcare systems. I would also say that we were also able to show less blood draws. One of the initiatives that we looked at was duplicative tests and daily orders, really decreasing the need for those. It's just habit to get it for 3 days in a row or 7 days in a row. And so really focusing on decreasing that means we had less sticks for our patients, meaning we're taking less blood from them. So while savings was a nice thing to see, of course, from a hospital system perspective, it was really great to see less sticks and less blood being drawn from our sickest patients. So that was it. Both huge wins.
Yeah, I mean, that's a huge win-win, right? I mean, you have better quality lives for the patients and you're able to save the health system money. I think it's fantastic. I'm just so proud of you. I have heard so many wonderful things about you for so many years. I've known you for so many years. I just really congratulate you for all of your successes. I am going to be looking for that book, and I'm sure our listeners are going to be looking for that book in the near future too. I think it would be great not to give you another project. I know you're super, super busy, and you're a super mom as well, and you're a super mom to 4 dogs. So, hey,
I love it.
when do you have the time? But is there anything else you want to share with our listeners today before we sign off?
I think the biggest thing is folks feel like they don't know where to start, that they can't start, or that it's overwhelming. I would say this is a really important thing, both from a hospital healthcare system perspective as well as a global healthcare system issue. And I really think start small, pick one or two things. Again, go to the Choosing Wisely location. They have a list of 10 or 20 tests you can start with. Pick one or two and just build slowly over time. And you'll be amazed what you can get done to help improve, patient care as well as, the bottom line. Because at the end of the day, it is important for us to manage those resources differently and be able to use that money to apply to things that really matter.
Yeah, thank you. And Dr. Signorelli, again, we really, really appreciate you taking the time to join us today. And for those viewers who are just tuning in or who maybe just tuned in the middle of this podcast, if you would like to listen to this again, we are located at www.advancedstrategicpartners.com, or you can always tune in to Spotify, Apple, and we're now active on YouTube. So all you have to type in is The End Game by Melissa Butterworth. And I sincerely hope that you've enjoyed today's podcast. And I'm looking forward to speaking to each and every one of you in 2 weeks on our next episode of The End Game. Thank you again, Dr. Signorelli.
Thank you so much for having me.